Mr. Chairman, ladies and gentlemen, I thank the Association for this opportunity to share with you over the next 15 minutes or so some of the life of Richard Bright, who was one of the most outstanding figures in the history of nephrology, bringing it up to date with a more personal encounter with one of his family, two of his family, in fact. Bright was brought up in a small village in the southwest of England called Ham Green, south of Bristol. He came from a fairly wealthy family, and Professor Cameron, who of course worked for many years at Guy's, has a great knowledge of the family as a whole, who worked in many fields. His father wrote a letter to his headmaster when he was at school. And this is what he said about his son. Although he may never show great brilliance, yet he will make a respectable figure in any profession. How wrong can fathers be? During his teenage years at school, he decided that he would study medicine. This was despite the fact that his father intimated to him on a number of occasions that he thought the medical profession was a pretty poor field to go into. But he persevered, and at the age of 19, he went first to Edinburgh and then to Guy's, and we have both of those establishments represented here at this Congress. While he was a student, even then, he had a reputation about observation of patients. It is said that he learned to smell, to listen, and to feel with his hands. He was apprenticed at Guy's as a student to a very revered and long-standing physician, Dr. Babington. And as well as that, he had a strong interest in pathology, and studied under Dr. later Sir Astley Cooper. He was actually a very good artist, and as Professor Cameron said, there was no photography, and so he drew himself and coloured himself many organs, particularly in vitro, following autopsy. And in 1811, for the first time, he drew what we now know as the granular kidney. He qualified in 1813. In 1816, he was working at a fever hospital outside London, of course dealing with many forms of infection. He himself contracted typhus, followed by pneumonia, and was desperately ill. And most of 1817 he spent in convalescence in London, and his father came up from Bristol quite often and stayed at a hotel, and as he recovered, Bright was able to visit him there. And in those visits he'd met many of his father's friends. Among those was the famous engineer Isambard Kingdom Brunel, who later became one of his patients. From what I said about his interests and approach as a student, you will realize that he always recognized the importance of taking note of physical signs, and he also wanted to link those physical signs to what was sadly not uncommonly found at autopsy. He developed a strong interest in excess fluid retention, then referred to as dropsy. He felt this linked with renal malfunction. In fact, the patient whose granular kidney he had drawn in 1811 died of dropsy. During his years, around this time when he had returned to work, he visited Paris. He met there a Dr. Pierre Royer, who described la maladie de Bright, Bright's disease. In 1820, he became assistant physician at Guy's, and in 1824, full physician and lecturer. His teaching methods were often criticized by his colleagues. This is what was said of him at times. He actually undressed his patients to examine them. He used the suspect method of percussion, and he outlandishly used a stethoscope, referred to by some as a foolish toy. He also taught the importance of analyzing any specimen that was obtained from patients during their lifetime. And of course, he particularly focused on studying and investigating the urine, and described a method of detecting protein in the urine by heating it in a teaspoon over a candle and seeing if it coagulated before it actually boiled. He continued his interest in dropsy, and in 1827 published 23 cases which he described as renal insufficiency dropsy. Of those 23, 17 died. He self-illustrated the findings at post-mortem. And 3 of those kidneys, Professor Cameron would know this better than me, exist still in a Guy's museum. Bright's disease was first of all thought to be only a disease of the poor. But this was explained because most of his patients in the public system came from an area at that time which was poverty-stricken and downtrodden in Southwark in southeast London. And over a period of time, however, it became recognized that the disease was a disease which affected all stratas of society. In 1832, he was made a Fellow of the Royal College of Physicians of London, and the following year invited to give 3 Goulstonian lectures. The third of these he entitled The Renal Origins of Dropsy. He described many cases in that lecture and the results of analysis of 296 urine samples. He described from post-mortem appearances 4 types of nephritis and noted that the patients often had raised blood ureas and that their history often involved that of convulsions, vascular disease, left ventricular hypertrophy. Later on, he described the fact that scarlet fever patients sometimes developed proteinuria and renal damage, not always. And this, of course, is what we would call post-acute streptococcal nephritis today. The treatment that he prescribed at that time was diet and bed rest. How little has changed. This is a picture of Bright in his prime, hangs in the Royal College of Physicians. In 1851, probably because he used his stethoscope, he made a self-diagnosis of aortic valve disease and started to have symptoms of cardiac failure. He had edema, and some people thought he was suffering from his own disease. But that was because he did not let anyone know that he had diagnosed himself with cardiac problems. He continued to see patients both in the private and the public sector. In the private sector, there were many renowned people, members of the royal family, the great poet and poet laureate Alfred Lord Tennyson, one of his patients. And then he met again Isambard Kingdom Brunel, who had developed edema and loin pain. Remember that he had met him first with his father, recovering from typhus. Bright diagnosed renal failure. Brunel died of renal failure and a stroke in 1959, aged 53. But Bright had predeceased him just a few months before. This was the obituary about Bright in the Times at the time. The lamented gentleman had received patients and was out in his carriage on Saturday, the 11th of December, after which he complained of indisposition and retired to his chamber, which he was destined never to leave. There was also an obituary in The Lancet, written by the editor, Dr. Thomas Wakeley. Wakeley had often been critical, almost personally abusive of Bright during his time, and so his obituary in The Lancet was rather a surprise. Wakeley wrote this: "The medical profession has lost one of the most original, observant, and philosophical minds. He contributed more than perhaps any other to form medical opinion of his day." He died on the 16th of December, aged 69. Well, so much then for Richard Bright in a very short time. What then brought back his name and memories to me? Before I retired, I was doing a clinic, a renal clinic, at the Chelsea and Westminster Hospital in southwest London. I called for the next new patient, and a tall, elderly lady walked into the room and shook my hand very firmly. "Before we begin, Dr. Phillips," she said, "I thought you might be interested to know that I am one of the surviving members of the family of Richard Bright." Well, of course, this made me sit up and take notice, perhaps a little more than usual. She was an extremely erudite, self-possessed lady. She had mild renal failure, but she was normotensive and had a normal scan. And at the time, I said to her, I didn't think there was anything that we needed to do, but just keep an eye on things. Her reply was, "I don't mind what you do, as long as you don't stop my 2 brandies and soda that I have every night after supper." She was 94. 3 years later, and this I have a picture of her when she was in her prime, I think you would agree with me that she may not be so well known, but she was certainly better looking than her famous predecessor. A few years later, I had the pleasure of having lunch with her and her sister. Her sister had written a biography of Richard Bright, which she subsequently brought to me on another outpatient visit. Her sister herself was an amazing character, a nurse who had gone to Dunkirk with the first wave of troops reinvading France. Her sister told Joan that she should show me her book. Joan, the patient, was rather reticent about this, but eventually she got it from her bookshelf. It was called The Inner Circle, a view of war at the top. This described her life in general, leading up to her appointment at the Cabinet War Rooms, which were under Whitehall in central London, and which was the main base for Winston Churchill during the Second World War. She worked for General Lord Ismay, who was Chief of Staff to Churchill. In her role at the Cabinet War Rooms, she had two main functions. The first one was to produce a system of reference that could be looked at by the various visiting leaders, military leaders of the time, who may have been involved in warfare in one area, but who then wanted to catch up with events in other areas. And this was, of course, before computers, and she developed a written system that enabled those leaders to very quickly pick up on what was going elsewhere, and it was much appreciated and very well carried out. Her other role was to look after the domestic and technical requirements of the British contingent, often involving Churchill himself, when travelling to other areas of the world for major conferences. This included Tehran, Yalta, Moscow, and Potsdam. In Tehran, she was there, and there was a dinner held to celebrate Winston Churchill's 69th birthday. You will see in this picture Churchill not holding his usual cigar. On his right, Stalin, and on his left, Roosevelt. In her book, she described a very amusing event that occurred at this dinner. The time for desserts came, and an Iranian waiter entered the room bearing a large tray with an elaborate ice cream dessert on it. He was fascinated to see Stalin, who he had never seen in the flesh. I doubt he'd seen the others either. He walked round to the back of the top table, not noticing that the ice cream was sliding on the tray that he was carrying. As he got behind the three leaders, the ice cream slipped off the tray fully. It fell onto the head of the Russian interpreter, sitting just out of vision on Stalin's right. The interpreter continued interpreting without interruption. I think it was rather good that, for the waiter, that the ice cream landed on the interpreter's head, or if it had landed on Stalin's, he might have lost something more than his ice cream dessert. So my reminder of Richard Bright was meeting two of his great-great-nieces, Joan Bright, whose full name was Joan Bright Astley, which harks back to Bright's training at Guy's under Sir Astley Cooper. Joan died at the age of 98. Her renal function had remained stable, and she died of pneumonia. I'm going to end by just reading two slides which are in the were in the St Bartholomew's Hospital Journal about Richard Bright. Dr. Richard Bright of Guy's had several patients large in size. Their legs were swollen as could be, their eyes so puffed they could not see. To this edema, Bright objected, and so he had them venisected. He took a teaspoon by the handle, held it above a tallow candle, and boiled some urine o'er the flame, as you or I might do the same. To his surprise, we find it stated the urine was coagulated. Alas, his dropsy patients died. The thoughtful doctor looked inside. He found their kidneys large and white. The capsules were adherent quite. So that is why the name of Bright is associated with nephritis. Thank you.